So what would you do with someone who came in who had all of these symptoms and their labs were negative?
Here's the thing, bring in your labs. Let's look at them. Because I hear a lot, like I've had so much workup. I'm sure you hear this all the time. I've had tons of labs, all the labs. And I look at the labs and I'm just like left scratching my head. Like, why are these labs so random?
I actually had someone recently who said all of their tests was negative and they brought in the ANA and it was with a reflex, but it was like only 3 or 4 of the markers. And there's like up to 9 to 11 markers. So even if someone did an ANA with a reflex and there was only like, what I've seen people come in with a reflex with only 1 marker and then they're like, oh, everything is negative, but an ANA reflex should have all the other markers associated with it.
Yeah, I see that a lot too.
And even if the ANA is negative, you should also back it up with an ENA, which is a slightly more specific type of ANA testing to see if that also comes back positive. Now, if all of that is negative, then what do we do?
Well, first of all, let's just dissect this phrasing of bone crushing pain. That is like a very specific type of pain. If you're having pain in your bones, that is very different than pain in your joints, right? That combined with fatigue and hair falling out is very concerning to me as a doctor. It makes me a little nervous, and I wouldn't only order an ANA and just like see if maybe it's autoimmune in nature. So the bone crushing pain, if you're having pain in your actual bones, that makes me worried for some sort of like bone cancer. And I would need to be doing some labs and imaging to work that up.
Yeah, that would make me nervous. I would probably also order what's called a protein electrophoresis, which kind of differentiates between autoimmune diseases and multiple myeloma, which can present a lot like an autoimmune disease, which is a type of bone cancer.
Yeah. And also like lymphoma. So looking for like swollen lymph nodes, I would be doing a lot of physical exam if this was my patient, right? The wording of bone crushing pain makes me nervous.
Yeah, that's a very specific descriptor. Yeah. So we would, I agree with that. It's a good differentiation to make.
Yeah.